What happens when members of the operative team have to sneeze when they're scrubbed into surgery? The tendency, if the patient is in front of you, is to want to turn your head to the side to sneeze away from the patient, but that's actually wrong. Your mask, when it's on, air escapes out the sides, so you actually want to take a couple of steps back, sneeze towards the patient. That way the air can escape backwards, and then any air particles will actually go out the sides of your mask and away from the patient and the surgical field. Because if you sneeze this way, it'll go directly into the patient.